Well, welcome. Can everybody hear me okay? Yeah. All right? All right. I just wanted to come touch base with you a little bit this morning about Kadlec's primary care system and some of the opportunities we have for our patients. Ideally, we're on a health pathway with you guys, trying to help you be as healthy as possible for as long as possible. And so I'll share a bit about what's going on, some of the opportunities we have, and what's happening. So
talk into the mic, please.
Okay. Can you hear me now? Is that better? Sorry. So basically, we look at healthcare with our patients as kind of a foundational pyramid. The best relationship with patients and our system is through your primary care provider. Now that can look like a few different things. And as you'll see up here, we have primary care, internal medicine, and geriatric level care. We'll kind of go through some of those pieces as we go along. But we really want to try to configure like the best location for you, the best provider, the best relationship, and develop that as we go along. So let's start with primary care. In many cases, primary care providers, primary care physicians, nurse practitioners, and PAs are able to really care for your whole spectrum of need. And as patients go through their life and they're generally healthy and things are going on, they may have some chronic issues and chronic conditions, your primary care provider is kind of that one that can work with you through your healthcare pathway all the way through. They're really that foundational relationship. They're going to help you coordinate specialty care services. They'll help you get to the right places. And they really need to help you with your desires on how you want to see your health care go. There's comprehensive care for all ages, and we do have same-day appointments available. We also have new opportunities where there's direct scheduling available to the providers for certain appointment types. We also have, through our Epic interchange, we have what's called My Chart. Used to be K-Chart. I don't know if any of you have interacted with that, but that's kind of your pathway to be able to connect with your provider and your provider team to say, hey, things are changing, or I need some help with this, and then look at different options for your care. And then again, as I said, the direct scheduling has become kind of a new option for new patients as well. They can go on and see when they can get a new patient appointment with one of the providers in our network. So primary care generally focuses on prevention, chronic disease monitoring. Depending on the level of the chronic diseases and those type of things that are going on, they're going to manage and maintain those. Routine medical conditions, and then also acute care issues. If you have urgent issues that arise, come in and see your primary care provider and get that taken care of. Now, there are going to be cases in life when things get a little more complex than what primary care generally deals with in their mainstream. And that's where you start talking to your primary care provider about what's next. Is internal medicine a little more appropriate for me? And so that's kind of the next pyramid. This is still a primary care provider for you, but it becomes important when you have multiple chronic conditions, or there's issues that maybe become a little more complex that the physician or nurse practitioner may not be as comfortable with, to say, hey, maybe it's time to transition to internal medicine. Within that realm, basically you kind of come to agreement, look at how you get into an internal medicine provider. It takes a little time sometimes to get into them, but that primary care provider can bridge that pathway until you get to that internal medicine provider and get your appointments set up. They're really focused on more complexity, complex care, complex issues, multiple chronic conditions. So for example, things like hypertension, diabetes, elevated cholesterol, COPD, or all of the above. And a lot of times that happens when there's multiple issues going on. They really hone in on those and focus on what's happening with your care. Now, again, as life happens and things become more complex and disease processes set in or things happen, our next level on our pyramid is our geriatric care. We have our senior clinics that have geriatricians and geriatric nurse practitioners that are specifically trained for highly complex, high-level care for those patients that need that. Generally, when you go to geriatric level care, it's a referral between either you and your internal medicine provider or your primary care provider that said, hey, some of these disease processes or some of these issues that are going on are at this level of complexity where we need to have these really comprehensive visits with the patients and really wrap care around them in a deeper factor. Now, it's not always age dependent. I mean, we have 92-year-olds that are seeing their primary care provider. They don't have a lot of chronic comorbidities or issues. In other cases, some younger individuals have more complex situations and they're in senior care. So as you coordinate with them, they kind of coordinate a network. We also collaborate with the skilled nursing facilities, home health groups, and assisted living facilities to really make sure that care is being provided on a comprehensive level. So what constitutes geriatric level care is really things like when you have maybe stroke issues, Alzheimer's, dementia, chronic heart disease, Parkinson's, immobility, walkers, wheelchairs, those type of things. A lot of complexity, a lot of areas where the geriatric providers are really trained to take care of those issues. So that's the core. That's kind of the pyramid. That's your direct relationship with your primary care provider and the way you interchange with most of your health pathways. Now within that, there's times where urgent things pop up, right? So how do you get care when things are more urgent and maybe you can't necessarily get into your primary care provider? So we have some options for you. Kadlec Express Care, I don't know if you've seen them or seen some of them around, but we have 4 of them that we have put in place over the last few years. 2 of them are in standalones, and then 2 of them are in the Walgreens clinics at different locations in the community. So what is Kadlec Express Care? Express Care is really those urgent appointments, and it's actually an appointment. It's not a walk-in. You can go online and schedule an appointment slot, or you can call and get your appointment slot ahead of time and then just present yourself at that time, and there's no waiting. There's no big waiting rooms. It's a single room space with a provider, and you are able to just go present yourself and be seen for issues. It's a great alternative when it's beyond normal hours as well. So they're open 8 a.m. to 8 p.m. 7 days a week. So if your normal primary care clinic isn't open, generally there's express care opportunities. And if all the appointments are gone, it'll allow you to look at other sites and other locations and be able to select those and go get an appointment there. If they're all gone for the day, as sometimes happens with cold and flu season, the next day pops up and you're able to book an appointment maybe for the next morning or whenever you need that. So what do you go for these for? Things like urinary tract infections, cold and flus, allergies, eye irritations, cough, sprains, cuts, scrapes, strep. They have limited testing that they can do on urinary tract infections, strep, cold, flu symptoms, those type of things. And so kind of, those lower level things, they don't have anything like x-ray or anything in these. So it wouldn't necessarily be that level if you have symptoms of pneumonia or an injury that may need an x-ray. But for the lower level urgent areas, Express Care is just an amazing opportunity. I've used it with my family a lot. It's very convenient. It's easy to book your appointment. You just go online and you can select the time slot. and then you can hang out at home until you're ready to go to your time slot, and then you're not in a waiting room with a bunch of other people that may add to your illness. So that's one of the first parts. Now we also have what's called virtual express care, which is in partnership with Providence, which is our partner. We, through this virtual express care, this is open and available 7 days a week from 8 a.m. till midnight. So in this case, you're actually getting on either your phone or a personal computer or something, and you're interacting with a provider on the other end, and they're seeing you and you're seeing them, and they will go through a series of what are your symptoms, what are some of the things that are going on, and what's happening. Now this isn't for everything, but it is a great opportunity to say, boy, something's going on, I really don't know what's happening, I need to kind of get a consultation and figure out what's happening with my issues. They are able to kind of go through these processes and work through some of these illnesses. You know, if you've got a fever, cold, headaches, sore throats, respiratory infection, eye irritations. And the good part about this is it's a very inexpensive visit. I think it's $49 or something like that. But if they're not able to treat you and care for your issue, and they say, oh, well, let's get you an express care appointment the next day, or let's get you a primary care appointment the next day, and you go the next day, this will be a free visit. They write it off and they don't charge you for it. So it's really a good opportunity to kind of look and say, hey, you know, what's my best path if it's after hours and I don't know if I want to go to the ED or not. You can look at these options. I heard a really great case of this. One of our employees that works for us, that one of their neighbors was having issues, and so he calls him over and he's like, well, why don't you try this virtual express? And so the individual was having rash and irritations and those type of things, but it was 9 o'clock at night. So like, what do you do, right? So they got on this virtual site and interacted with the provider, and that provider was able to, through the symptoms and signs, and then also by having them hold their phone up to their skin, determine that the individual had shingles. So normally, I mean, that's a problem. You know, does a person, they're in pain, it's irritating, what do? Do you have to go to the ED because it's after hours? In this case, they were able to diagnose it. They called in an after-hours prescription to the after-hours pharmacy. By 10:20 at night, that person had the medications they needed and they got relief that same night. So I'm like, wow, that's really cool. So, you know, again, there'll be specific use cases for something like this, and you know, it's there if you need it and when you need it. And then the other part to the more urgent components that we provide is our urgent care. So urgent care is basically more of a walk-in basis scenario where patients come in with urgent issues. Now they do have lab and x-ray there, so if it's a higher level issue or things that are going on that are more complex, they're able to handle and take care of those. Now, historically, we have had such demand on our urgent cares that there's wait times, right? So what we're implementing in just the next couple weeks is a program called Clockwise MD. And what it does is it'll make it a little bit similar to our express cares, where you'll be able to go online and grab an appointment slot or an appointment time frame. So what that does then is it registers you at urgent care to say, hey, you know, I need to be seen. And then it'll tell you, hey, here's the most appropriate time slot for you to be able to present yourselves. It'll register you in there. And then when you go in, and check in, you'll be pulled up on the board and you'll be seen quicker and in more of a rapid fashion. Now, it will also update you on your phone, if you get texts and those type of things, that it'll say, hey, we had a wave of patients come in, wait another 15 minutes, and then present yourself, and then you can come in that right time slot. So we're hopeful that this will alleviate some of the longer wait times and some of the waiting in the exam room or waiting in the waiting room with other patients that have illnesses and that type of thing, that you'll be able to come more readily available when your appointment time slot comes. So this urgent care is really, again, for those immediate urgent issues that come on: UTI, skin conditions, ear pain, falls, sprains, fractures, shortness of breath. The other offering that we are just implementing this fall, hopefully before cold and flu season, is we're going to start offering fluids to patients. So say you get flu and you get sick, you're just dehydrated and there's issues. Normally, patients would have to present to the emergency department to be able to get IV fluids and get your levels back up and get your stomach settled and all those type of things. So we're going to start offering that in our urgent care as well, so that you don't have to go and wait in the long lines at the emergency department. So that is kind of the whole spectrum of the offerings. We continue to look at how do we create convenience and better offerings for our patients so that you can get care in your time frames and when you need it. And then hopefully also that you have a good relationship with your primary care provider and can work through all the things you have in your life and be healthier longer. That's what we hope to get. So thank you. Any questions anybody has? Or?
Is that all covered under insurance, Medicare, et cetera?
Yeah, so, and yeah, that's a great point, is because all of these systems are integrated with our system, the one great thing is they're all on the same electronic health record. So they're all on Epic. So your primary care provider can see you went to Express Care or you had a virtual visit or whatever, and it's all connected. So that's a great thing. And they are covered under, they will bill out your insurances as well, yes. I should have been prepped for that. There is, which one?
It's right.
Yeah, on 395, I believe it. Yeah, out South Kennewick, off of 395. It's I think it's a Walgreens.
Was it Walgreens?
Don't quote me on that. Is it Rite Aid? Okay. Yeah, unfortunately, there's only one, which is a little frustrating, but.
Hey, Randy, would you explain on the insurance side, I guess, the difference in, obviously what we're trying to do is get people from going into the emergency room when it's not a true emergency, and maybe explain a little of that for us so we can delineate.
Yeah, when you look at these pathways, certainly the emergency department is the most costly and the most expensive, both from a out-of-pocket and or a system cost perspective. And what we're trying to share is really that it's needed when it's needed. I mean, when it's a life-threatening emergency, you call 911 and you go to the emergency department, no questions asked. But we're finding there's a lot of people that because it's after hours or there's not good alternatives, that they're just going to the emergency department for lower level conditions and issues. And it's like, we need to really get the word out that there's some other options available and there's better avenues to approach it. When you look at the step down, the emergency department is the most expensive. Urgent care is next, but the difference is huge. Urgent care is much less expensive, and generally there may be like a $50 copayment versus like a $250 copayment, depending on what your insurance plan is. And then Express Care is cheaper than that, and then virtual is definitely the cheapest option. I think we had one over here real quick.
Is Kevin in the process of bumping up the number of internal doctors?
Yeah, it is a good question. Internal medicine doctors are hard to find. It is very hard. And we're running the same thing. What's happened in a lot of cases is the hospitals in all the areas are kind of gobbling up the internal medicine providers to be hospitalists in the hospital, which are, you know, basically acute care providers. And so it makes it hard for us to compete and get those.
If you find an internal doctor that you would like, can you put on a waiting list?
Yeah, certainly there's, it may take time, but that's where I would talk with your primary care provider and say, hey, I'd really like to see, even if it's 6 months out or 9 months or whatever, grab a new patient appointment with the internal medicine and then have your primary care kind of still work with you until you're able to establish that appointment. So we don't want to leave you in a gap or in a lurch, but it may take a little while to get into an internist. Yeah, that could be very true.
Telephone numbers. You've listed quite a few places we can go, but do we have phone numbers? Some of us don't have computers.
Yeah, so I think on my slide presentation is both the website and the phone number for direct calls. So, and I think those will be attached if I'm not mistaken. We have another question over here.
Sir, I think right here. You still have a question?
Well, I'm having a hard time getting perspective on this.
Okay.
Now, my primary care doctor is an internal medicine, is his main emphasis.
Perfect.
And he's not, what's his tie-in to Kadlec or to the system you're describing here?
Well, I guess I would ask is he a Kadlec internal medicine provider, or is he a community?
No, he's independent.
What's his name?
Yeah.
Dr. Sharma.
Dr. Sharma.
Oh yeah, yeah. So he's an independent provider. So he's not part of the Kadlec network. So it's a little different. I mean, he's not going to be on the same electronic health record we're on. He's not going to have the same connectivity. So when you go to see him, and if you go see some of our specialists, he's going to have to get information through faxes and those type of interchanges. Most of our own internal providers have the electronic health record, Epic, which ties everything together, and then you can connect with them. So I mean, that's kind of the good value. But there are a lot of community providers that see you independently. Generally, it's not a big issue until you start having to have a lot of specialty appointments or coordination of some of your services, and then it becomes a little clunky. Unfortunately, in some of these electronic systems don't talk to each other very well. And I wish we could solve that.
We're going to have to break our relationship to doctors that we've had decades.
No, I'm not saying you change your care. You can see whoever you should, and your internal medicine provider, I would stay with them and have him care for. It's just a little more complex in that environment. You can still go to these express cares and others, and we'll bill insurance and we'll take care of all those things, and there's no issue with you going to any of those. The value of having the Kadlec network is they can all talk to each other seamlessly through the electronic health record, and they know what's going on with your care much more efficiently than when you have a provider that's not in the same network. Does that help?
Pretty much, and, not simply Dr. Sherman, Dr. Zarowski,
Yep.
the cardiology, and Dr.
Right.
Shavla, the urology.
Yep.
And I can't recall the name.
Yeah. Now the cardiologists have privileges at our hospital, so there's no issue with that, and they're all great providers. We need all the community providers. We can't do it alone. Kadlec's not the only game out there, and we definitely need other primary care providers, internal medicine providers, and cardiologists and those type of people.
You're simply saying that there are additional ways for me to get care.
Yes.
Particularly at bad times.
Yep.
Right.
Yeah, and I guess when you're making that decision tree to say, is this a life-threatening, do I need to go to the emergency department, or can I look at some other options? That's kind of what we're saying is maybe think about some of the other options before you, immediately determine it's an emergent need and go to the ED.
Did Kadlec buy out Providence or Providence buy out Kadlec?
Yeah, I wish we had the money
It
to
was
buy
the
out
former.
Providence. Yeah, yeah. So Providence Health and Services about 3, 4 years ago. 5? Is it 5 already? Oh my gosh. About 5 years ago, acquired Kadlec. They largely say the relationship in this community is with Kadlec and their patients. So they haven't put Providence on the names. They haven't infused any of that anywhere, but they're our parent company. And now it creates good and sometimes challenging situations. The good is we have now a network of one of the largest providers of care that we collaborate with and we work with. So Providence, Sacred Heart in Spokane is part of Providence. Swedish on the west side of the state is part of Providence. So we really have good collaborative partners. If complexity and those type of things warrant, we can send patients and help work all again under the same network, same Epic, same system. So.
Don't they have St. Mary's in Portland?
Yeah. Well, I don't know if it's St. Mary's, but
St. Mary in Walla Walla.
Providence is huge in Portland. They have St. Mary's is up in Walla Walla.
St. Vincent.
St. Vincent's in Portland.
The best back doctor there? Ooh, he was great. But Dr. Boyle's great.
Yeah,
I call
right.
Dr. Marvel.
Yeah.
Wasn't there an urgent care over in Pasco, somewhere around the area of Broadmoor, and somebody told me it closed?
Yeah, so what we did in that instance is we kind of had some urgent care providers for a while until we opened up the express care at Walgreens. So that was kind of just a bridging scenario until the express care opened up at Walgreens.
I have to tell my sister, because she remembers.
Yeah.
That's where they used to go, 'cause they lived in Burbank.
Right. So.
If a woman wanted a tubal ligation, could she get it at Catholic?
Hey, great question. Okay, she asked about a tubal ligation, if you can still get it, because Providence is a Catholic organization as a parent. So when we signed on with Providence, we signed under what's called Western Health Connect, which was a different organization that Providence had to set up that's secular and not Catholic. So we don't have the same guiding principles and guidelines that they do. Now there are some things that Kadlec never did and still wouldn't do. Tubals, I think we do that. So there are some differences between us and Providence. Swedish is under the same thing. So Swedish is also under Western Health Connect, which is where we're at. And so they have a little difference in how they practice and what they can do versus the standard Providence system that is restrictive on certain things.
That's an answer.
Yes, we do here at Kadlec. So that was, I guess if that, yeah.
As long as they don't do abortions.
No, we don't do that. Okay, great. I'll turn it over to Jim, and you can go from there.
All right.
Where's the cupcakes?
Thank you, Randy. I think. I'll borrow your clicker.
Yep, you got the clicker.
Well, good afternoon, everyone. It's great to see all of you. And Randy is a wealth of knowledge. And I'm going to touch kind of on Kadlec over the past 75 years from where we are today and kind of where we have been. And Randy and the team on our medical practice side, what we call our medical group or Kadlec Clinic, it has grown tremendously in the last 10 or 15 years. We now have roughly, 300 providers, which would be physicians, nurse practitioners, and physician assistants who are part of our Kadlec Clinic medical group. And that's a combination of the primary care network and the physicians and the providers that Randy just alluded to, and then our specialists. So we are becoming obviously a very, very robust, which I think is a good thing for this community. Obviously it's grown so much. I want to spend some time, you know, this right there, it's our 75th year. First of all, how many were born at Kadlec? Oh, wow. Okay. And I'm not going to ask you how many years ago. We know you're not over 75. That's a good thing. But what's been fun is 2019 is Kadlec's 75th year, and we've been trying to celebrate all of the legacy over that 75-year period. Everything from the patients who have received care there, to the people who have worked there, to the providers that provide care there, and then to a real special group of people that I like to work with, and that's people who volunteer at Kadlec. And our auxiliary is a great group of people that they're this year celebrating their 70th year. So 2019 is a year of milestones at Kadlec, and we're really proud of that. I just hit my 25th year at Kadlec, which really kind of made me realize how old I am. But I always look at the work I do, the great part about it is I learn something new every day. I'm not clinically trained, and that's a good thing, but I do learn something new every day, and I think that's just because of the nature of the work that healthcare is. It's changing, and for the most part, it's changing for the better. Obviously, the advances that we're seeing in medicine. So it's a really dynamic time, I think, to be working in healthcare, and it's really a proud time, I think, to see Kadlec have grown into what it is. A lot of people, I think our biggest challenge is, well, you've gotten so big. Well, I think our big challenge is to remind people that healthcare is a very individual, personal experience. And our goal of what we call our caregivers, our employees, is to make sure that no matter how busy we might be, that interaction that we have with our patients is that personal one-to-one interaction. So hopefully when you receive care, that's the type of care that you receive. That is the goal. We don't always get there, but that, believe me, is the goal that we all have as caregivers. I always like to, I do some of my presentation here comes from a new employee orientation that we do every 2 weeks with our employees. And so I always start out, especially as we celebrate this milestone, when we hit 70 in 2014, we realized a lot of people didn't know where the name Kadlec comes from. So my first question I always ask is, how do you say the name of our organization? Kadlec, right? 2 syllables. Have you ever heard a 3rd syllable dropped in? To make it Cadillac, like the car? Now, I have a theory. Of course, I do PR, right? My family was in the car business. So, as the PR guy, I don't mind when you all call it Cadillac Regional Medical Center. Why? What do you associate Cadillacs with? Yeah, quality and excellence. Some people go, expensive. But I always joke that we're very happy his name wasn't Pinto. Or, you know, fill in the blank with the lemon car that you may have owned. I'm a Chevy guy growing up, so I always pick on the Fords. But it's Lieutenant Colonel Harry Kadlec. And did anybody go to the Atomic Frontier Days a few weeks ago down in Howard Ammon Park? It was really cool because I think it really celebrates the history of Kadlec. And obviously the Manhattan Project, the secret mission at the height of World War II, Kadlec was with the Corps of Engineers, and he came in as part of that effort to build what the whole Manhattan Project and the Hanford Works that was going on back then. Kadlec died of a heart attack shortly after the original Richland Hospital opened. And this is our weird Washington fact that I always share with our staff. He was the first person to die in the new hospital. But that's not why they named it after him. They named it after him because if you put your mind in of what was going on at that time in 1943 and 44, when Hanford was basically transforming our area where we live today, it was, you know, World War II was at its height. And so he was a very influential figure when all of this Hanford Manhattan Project work was unfolding. And so he died at the age of 57. And so he was a very influential person at that time. And so they changed the name to Kadlec Hospital. And so that's where we have that name today. He's buried at Arlington National Cemetery. And so it's really, you know, and again, I like to show, I'm going to go back here real quick. I'd like to show this shot versus that shot. Okay, now this is funny. Well, CUP would be what about right here? But that's Stevens Drive. There's Richland High School. There's the old Prout pool that used to be a 50-yard pool, the big pool. This would be Swift, right? But then look at us today. Look where we've come from. We have 3,700 plus employees. When I started in 1994, I think Kadlec had, Alice, do you know how many employees Kadlec might have had in the mid-90s? 600, 700 maybe? So we've gone from 600, 700 employees 20 years ago to 3,700 today. And I'm going to touch on this. This is a list of our board members. Kadlec is still, even though we're part of Providence, and we always have been, a private, not-for-profit organization. And the term not-for-profit means any profit that we make, any bottom line that we generate, any savings we have at the end of the month goes in to be invested into the healthcare needs of the community, whether it's in the form of facilities, whether it's in the form of new services, hiring new people. And so that's where the not-for-profit term comes from. And interestingly, in what we've seen in the Tri-Cities in recent years, Kadlec is now the lone not-for-profit health system remaining in the Tri-Cities. Kennewick General, which is now Trios, and Lourdes are both owned by a for-profit company based in Nashville. And so Kadlec, we take that, as part of, and Providence is a national not-for-profit health system. And so our board is a volunteer board comprised of people throughout the Tri-Cities area. What I always think is neat, having been in the Tri-Cities a long time, it used to be, everybody, Kadlec was Richland's hospital, Kennewick was Kennewick's hospital, you know the game. And to me, what's neat over the years is now Kadlec is not only a Tri-Cities hospital, it's a regional hospital for this region of Eastern Washington and Eastern Oregon. I'll show you a map here momentarily. And we have members of our board who come from all over the Tri-Cities from a variety of backgrounds. Here is, this is really a neat map here because Benton and Franklin counties is the primary service area of Kadlec. And I'm not sure if you've not paid attention to the population figures, but Benton and Franklin counties is about 300,000 people, which is surprising to a lot of people. And then you add further out into Eastern Washington, places like Dayton and down toward Walla Walla, the smaller communities, down into Northern Oregon, Hermiston, Pendleton, Heppner, Milton, Freewater. We get patients from all of those locations, and most of those are smaller, what we call critical access hospitals. And so we have great relationships, and we are kind of that referral hospital to those smaller communities. I tell people we are to the Prossers, where I grew up, the Hermistons, the Pendleton, we are to those smaller communities what Seattle and Portland and Spokane have typically been to the Tri-Cities. And so to me, the geographic reach, I tell people if you drew about a 90-mile circle around the Tri-Cities, that would roughly define where we get patients from. And I won't spend a ton of time on this. Randy covered our Providence Affiliation. We are a partner in the Providence system. Providence is a Catholic health system, and as Randy said, Kadlec comes under a non-Catholic business division of Providence. So that's why you won't see Providence formally in the Kadlec name, and the level of services that we provided are still the same as they have been before. We are now the second largest employer in the Tri-Cities, outside of the lab, Battelle. And as again, I touched on that, 3,700 people. You realize the economic driver that healthcare has become in this community. Our payroll is $270 million a year. Those 3,700 people have good paying jobs, and obviously they live here. And that's probably the best part, is that those people all live right here in our community and in our region, not just here in the Tri-Cities. Our emergency room, I'm not going to spend a ton of time on that, but it's grown substantially. We've added a second ER over in Kennewick. And together, those two emergency departments, we see over 100,000 patients a year in those. I always joke, they call them visits. Has anybody ever visited the emergency room? I think a visit is a little more, I think you need to say, it's like, yeah, right? It's kind of making it a little less formal. We deliver about 2,800 babies per year. And I think the story back in the day, and Alice and Becky can fill me in, the birth numbers at Kadlec used to be classified because the government did not want people, the enemy, to figure out why are all those people all of a sudden living in this area that until otherwise had been uninhabited. And so when they declassified that information, Kadlec had the highest per capita birth rate in the entire country back in that day. Our market share, just a quick time, our market share, which we consider Benton and Franklin counties, Kadlec's is roughly 56% of the market. and that's for inpatient care that they can measure. We're very proud of the care that we provide, and we don't do it for the awards. We do it to heal people and make them feel better and get them back living their lives the way they are. But in recent years, we've received some pretty neat recognition from not only some national publications that measure quality. We get measured on everything. It's crazy. And it's probably mind-boggling that you can go online and see. And many times it's not easy to figure out. But a lot of rating agencies across the country do that for the consumer. And so we have been very proud in a lot of areas of where we provide care to be highly rated among things like U.S. News and World Reports. There's another rating agency called Health Grades. And we get high marks in a lot of patient care areas, and we're very proud of that. Here locally, the Tri-City Herald does some consumer choice type awards, and we're pleased that they select Kadlec as the best hospital. And we're also regularly in the top as the best employer rated by the people who work there. And so we're really, hopefully, that's our goal is, we want to, if you're a happy employee, you're going to take care of your people in a happy way. This is just a quick list of stats. This is from the Providence St. Joseph Health. We're one of 51 hospitals that are part of Providence. There's 119,000 employees / caregivers that work for Providence. We were bragging when we hit 3,700. We thought we were the big kahuna. We're the minor kahuna now. But no, we are, it's a large, and that's I think what the point Randy was making, is there's a lot of collaboration that we can do. In my line of work, I have colleagues around the system that I can tap into for ideas on ways to better outreach to the community. And then all the clinical areas that we have, whether it's orthopedics, whether it's cardio, whether it's senior care, you name it, we have all these colleagues around the system that get together regularly to evaluate and share best practices on the care that's delivered. We're very proud to be a part of the community in a variety of ways. Certainly our role is to take care of people when they come into the hospital and the doctor's office, but we also have an obligation, I think, to help people find the resources that they need out in the community when they need them, whether they're families that don't have the means that others do, or whether they're people perhaps that are homeless that live in our community. It's our obligation to help reach out to all of the citizens that we serve. And we spend a lot of investment financially as well. They measure, it's called community investment. They set a dollar figure on that, and between the care that we do not get reimbursed for, the types of services that we provide out in the community, we do about $45 to $50 million in community investment each year here in the Tri-Cities. We've really been proud with the relationships we've developed to train and allow our employees to get further education. We've had some great partnerships with Columbia Basin College. There have been 2 facilities built just right down in the neighborhood of the hospital. Kadlec has invested $5 million to get both of those buildings built over time. Additionally, Washington State University has all its Tri-Cities-based nursing programs down at our Healthplex. Anybody go down to the Healthplex to work out or to take some of the classes? Kadlec donated 10,000 square feet of that Healthplex to WSU for that nursing training. And now our Providence Affiliation, they had provided investment to not only build the second CBC building, that's not up here, but they also provided money to fund an endowment to train nurse practitioners to get their doctorate. So if you're you start out as a nurse, you want to become a nurse practitioner, now you can stay right here and get what they call a DNP, a Doctor of Nurse Practice, right here in the Tri-Cities at Washington State University Tri-Cities, down here at the Healthplex. The Healthplex, I think I got a slide on here momentarily, but I'm not going to spend a ton of time. I think the services we provide. We are kind of that regional provider, whether it's cardiac, neurosciences in the baby side, in the women and children's side. We have a neonatal intensive care unit, which takes care of the sick babies and again, that's more of a regional service where we get patients from all over the region. The Kadlec Healthplex, okay, this will tell you how long you lived in the Tri-Cities. How many, start naming grocery stores that this building used to be? Got a Rosars? Payless. Wasn't there a Pay and Save back in the day? Rite Aid. Yeah. Well, it's now the Kadlec Healthplex, and we bought that building a number of years ago. And what's really neat about it now is we brought all of our outpatient services that were, until this opened, all over Richland and all over the Tri-Cities, but we put them all in one location so that now patients that seek care in those areas can get them all in one location. And it's a neat facility. We have patients of all ages there, and it's not unusual to see 600 patients a day utilize the care at the Kadlec Healthplex. This year, we are 75 years, as I touched on. I'm going to try and play a quick video. This has been fun this year to do, is we featured some of our people that have worked for Kadlec, some of the people who have received care at Kadlec, and some of the people who volunteer at Kadlec. And we've kind of helped share their stories, whether they're on television or through our social media channels. And do I need to put this mic up here, Ray, so they can hear it? Yeah. But we're just going to play, it's just a quick little 1 minute I want you to hear. This is an example of an NICU patient who is grateful that they got their care at Kadlec. Where are we putting that, Ray?
I came into the hospital at about 22 weeks gestation. At that point, there was no way that my baby would survive. Kadlec saved our baby girl. They were with us through the whole journey of when we weren't even sure if she was going to be here, all the way through making her healthy enough to come home.
The nurses here at Kadlec, they were always greeting us with smiles and asking us how our day was going, giving us every update they could about our child, and it's just an amazing experience with them.
The scrapbook is amazing. It's like a little story, really, that tells the story of Alexandria and our journey through the NICU.
Just her whole journey has been put in there with photos and little imprints of her feet, and just love.
No other hospital is like Kadlec.
Thank you, Ray. That's just an example. And a lot of what we try and do is tell the stories, not through Jim Hall, but through the people who receive the care. Because that really is, I always say, I remember one of the great examples is we have this freestanding emergency room in Kennewick. And when they built that, they said, what's the biggest challenge of going to an emergency room? Wait times, right? And so when we built that, we said, okay, they set up a model of care, everything from how they designed the construction of the building to all of the processes that patients access the care. They said, we're going to get patients in and out in 90 minutes. That's our goal. And you're like, yeah, right. Well, by gosh, it's been open 6 or 7 years now, and they are pretty close to that. And the whole thing, you can have the nicest commercials talking about a brand new building, but unless you can deliver on that promise, we as consumers of healthcare are going to go, wait a minute. And so to me, that's an example, and the Crams and the other people that we feature, these are their stories. And that's, to me, what I enjoy about my job is that we make a good difference in this community in a way that, whether it's a 22-week-old baby, or like my parents live in Prosser, they get their care, their specialty care here in the Tri-Cities. My mom with Dr. Hawk, who's a medical oncologist, my dad, Dr. Jamali. And so it's, and that's in Prosser. And so we have that reach, whether you live right here on Stevens Drive or whether you live, down in La Grande, Oregon, that reach, to me, is what's impressive and what's meaningful. And I know to all my colleagues that work at Kadlec, and I have Alice and Becky, who are fellow Kadlec employees who have worked over the years at Kadlec, and I would think that they probably would agree with me that that's that same commitment that they enjoyed during their careers. So I have a couple minutes. I'm happy to sit around. I know Kathy has cupcakes over there in honor of the 75th anniversary, and I'm happy to sit and answer any questions as long as you would like. Yes, sir. Right. It's an interesting point, and I think we try to, and we've been trying to strike the right balance between printed materials and online digital materials. And a lot of the facilities we have in what, like Randy described as primary care, those are located out in the community. So most of the family practice, internal medicine doctors' practices are located out in the community. And then if you need to go to a specialist, say a surgeon, who, they're going to be more inclined to have patients in the hospital setting. So we have those in and around more close to the hospital campus. But that's a great point. I think we need to really it seems like I think now we've got a little break in the action, I think, on major construction. So now would probably be a good time to maybe have that map developed to where we can show that for our consumers so they can help navigate. But I know on our website, we do have location maps that show, but to your point, it probably needs to be something that we can print out that really can be shown in a way that people go, oh, okay, well, that's where that urgent care is. It's over on Clearwater, or that express care is on Road 68, or wherever it might be. Right. Any other questions?
How soon are they going to be buying out Albertsons?
Buying, that's the most frequently asked question I've had. Is the Albertsons building, the old Albertsons store. I don't think that's in the works. I think that at one time they had thought about it to maybe, honestly, I think the thought could be to expand the Healthplex facility. But we are putting, where that construction is right next to the Healthplex. We just got state approval. We're going to be it's going to be a gastroenterology, they call it endoscopy care. And so the gastroenterology physicians, the GI practitioners are going to be located there. And so they'll be able to do all their GI procedures there. That's one of those real high demand. You got to wait to get the care to get those procedures done. And so I'm not sure what the timeline on that is, but I think within the next 6 months, hopefully, that it's a GI endoscopy.
Where is that?
It's on, where Pasta Mama's used to be? Everything's like on the west side, the west end of the Healthplex. It's just built right into the Healthplex, but it's on the Albertson side.
Oh, you mean the
Yes. I guess the old Rosars. Yes, ma'am.
What is the ratio of MDs to PAs?
I'd rather die.
The ratio of MD, it's too bad Randy's not here. Randy could probably answer that better than I. The one challenge I will touch on that point is, and that's why we started a residency program, and I'm not sure if you're familiar with how that works to become a physician. I didn't until I had to do some advocacy on it. You go to your undergrad for 4 years. You want to go to medical school, you go for 4 years of medical school. At the conclusion of that, you're an MD or a DO, but you then need to do a 3-year residency. And until you do that 3-year residency, whether it's in family practice or some other component of healthcare, you have to get that residency completed. And we, about 6 years ago, started a residency program here at Kadlec because that's the big challenge. Much has been made of they call it the healthcare workforce shortage. It used to be mostly in the area of nursing, but it cuts all across areas of the healthcare professions, physical therapy, all the different therapies, nursing, obviously, our providers, physician shortage. And there's less and less coming into the pipeline because it's so expensive to train physicians. And so that's why you're seeing more nurse practitioners and PAs, and especially in the rural areas. I mean, you're going to see that's one of the big challenges, and that's one of the reasons we started the Kadlec residency program, was the hope that most of the people who complete their residency, about 2/3 of them statistically end up staying close to where they trained. And so our goal would be that out of the, but we're only producing 6 a year, although we're going to 8. This year is the first class of 8. And I think there's 2 or 3 of them actually that are going to stay here and practice that just completed their residency. But that's a good point. You're just seeing more and more PAs and nurse practitioners doing that. So, yes, sir.
How about touching on the technologist standpoint, those that do ultrasound and all these technicians?
Yeah, it's crazy.
Technical jobs that are absolutely necessary to support.
I say a hospital is kind of like a small city. I mean, we have every kind of professional workforce that you can imagine. We have surgical technologists, we have x-ray technologists, we have, they call them radiologic technologists, I think, or the x-ray techs, because they do more than just x-ray. Surgical OR techs, they call them. We just did a really meaningful story. We talk about technology, but here's an example of and I'll maybe close on this because I was really touched by this employee that we have. We had an employee who served 2 tours of duty, one in Afghanistan, one in Iraq. He was wounded on his second tour. He ended up getting awarded a Purple Heart. He came home, he works as an OR tech in our operating room, and he came home and he suffers from post-traumatic stress. And a few years ago, he noticed that when surgical patients came into the operating room, they would find, occasionally they would find patients who were veterans, and usually it was their spouse that would kind of tip them off that, hey, Jim is he's suffering from post-traumatic stress. And some of the sudden noises or the lights might impact them in a negative way. And so Eric is his name, introduced this idea to the rest of the OR team. So when they identify before surgery a patient who is a veteran who might be impacted by post-traumatic stress, they put a little laminated American flag on the outside door of the operating room and inside the operating room. So that's a sign to the staff working on that patient to take that into account when that patient is either going into anesthesia or coming out of anesthesia. Not a real high-tech solution, a real high-touch solution though, don't you think? And his name's Eric Gonzalez. We featured him. We do a little radio program on Wednesday nights, and this year 9/11 happened to be on a Wednesday night, and so we had him on our program on Wednesday night, and it was real powerful because he brought some of his colleagues in. We actually had another person who had been a veteran who had had surgery, and they had used these principles when he underwent surgery, and it helped him during his case. So certainly these guys have all kinds of training, all kinds of technical training, but I would submit it's that that extra touch that they provide. And it was really interesting because I asked Eric, I remember asking him, I said, well, okay, now if it's written in, is it written into the chart that when you know this? He goes, well, Jim, sometimes you just look into the eyes of the patient if you're a veteran, and you know. He goes, we kind of sniff each other out, is what he said, which I thought that's an interesting choice of words. But at any rate, just a great example of the commitment, just one of the people that works taking care of people.
It's called heart.
That's right. That's right.
I'm just curious why the phone numbers keep changing. Every time I get them programmed in my phone, I punch a button to call some doctor, and I get there, and it's a different phone.
Just don't take the voice you hear when you're on hold.
Oh, I know.
Don't talk too negatively toward that voice,
No,
please.
I just say, Jim, I'm tired of listening.
I know. Come on, you tell me you're lying to me. Somebody's not going to be with me soon here. That's an interesting point. We ended up having to change a phone system, I think within the hospital, just about a year ago, because the phone company was running out of phone numbers. And so they ended up switching our phone system. I spent a whole afternoon in recording all these on-hold messages for the hospital and the clinics. But to your point, it's a good one. You don't think about this. When we were doing that, we had to do all this advanced preparation for when the phones were changing, because what was happening and I won't bore you with details, where we could normally just dial the last 4 on the phone, well, the new phone system, you had to dial a 3-digit prefix before the 4. And so, okay, all those numbers, you can imagine in the emergency room, the operating room, all these departments, those are all pre-programmed in. And so, you're having to go, what was that number again? Let alone, and then they had to reprogram them all into the speed dial stuff. So you're sitting there, what you think is an easy problem to fix. It took a lot of training and preparation to make sure that once they switched over, when they knew where to call and knew how to access it. But I think, from what I'm told, a lot of it is the community is growing, and they were running out of phone numbers, so they had to go to that system. That's why they've changed.
It just seems to me like the numbers that are on the old K charts from just 2, 3 months ago,
that's
I try looking up numbers in the phone book, I try looking them up online, I try looking them up, just the ones I programmed in my phone, and sometimes they're wrong.
Call Norma Jean, the switchboard operator at Kadlec.
I was just going to say that.
Funniest thing was we were doing a little video. Norma Jean has been our switchboard operator for 23 years, I think it is.
And that one doesn't get answered.
Yeah. Well, if you dial 0, if you get to 0, it will. But I said, somebody goes, well, what's your number, Norma Jean? And she looks, 0. Well, thank you for your time. Enjoy cupcakes. Kathy has cupcakes. It's great to see all of you.